Here we present the paper Automated Triage in Pandemics Support Vector Machine for Efficient COVID-19 Patient Classification. During the pandemic, medical resources were overloaded all over the world. This study focuses on developing tools to alleviate this burden for the attendants and improving the medical care. This study introduces an approach using support vector machines models to replicate the COVID-19 triage process based on patient-provided information and not on laboratory tests. The main goal is to improve conventional triage methods by integrating machine learning with medical expertise, improving the accuracy and patient outcomes in high-demand situations. From April 2020 to February 2022, Hospital Dr. Bernardo Sepúlveda attended 9,609 patients. From these, 1,834 patients were admitted to hospitalization. Due to the lack of early global triage guidance, a specific COVID triage was developed by the emergency department of the hospital. The COVID triage was designed with only three classifications: green, yellow, and red, to facilitate the learning process of the triage personnel and the system's interpretation and use. The criteria to classify the patients were divided into major and minor criteria, and each one had a specific score that can be seen in this table. A computer program was designed to record this information and to automatically calculate the sum of the COVID triage scores to assign the correct triage color. If the sum of all criteria scores was 10, then the patient was classified as red. If the score was 6 to 9, the classification was yellow, and 5 or fewer points was considered green. Nevertheless, the physicians had the authority to modify the classification color because they can assess situation holistically and draw on past experience to identify patients that might worsen their condition soon. In order to generate a classification structure, three supervector machines are proposed, such that only uses data obtained from self-evaluation, and the patients are not requiring clinical data to assign them to a triage group. Success rate of triage classification for green, yellow, and red categories plotted on the y-axis with error bars representing one standard deviation. The x-axis indicates the increasing fractions of the total number of patients used in the training process, with the remainder of the data reserved for testing. The system achieves a success rate exceeding 98% for both green and red triage classification, only using over 3% of the total patient data. At the onset of the COVID-19 pandemic, emergency services worldwide were already facing critical levels of saturation. A conventional triage process, which typically relied on quick assessment to prioritize patients without aiming to diagnose, were insufficient facing a novel spreading virus. The excessive workload of medical staff is a factor long associated with suboptimal medical decisions. The supervector machine's analysis capacity is more accurate and rapid than the physicians examining all the patient information and making decisions under pressure. The supervector machine's triage system presented in this study shows promising potential for improving emergency department triage processes. By automating patient classification based on provided information, the system showed a success rate of over 98% for red triage classification, using under 2.8% of the total patient data. The system's integration with clinical expertise ensures that it improves rather than replaces the clinician's role in the patient care.